Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Nutrition. A nurse is teaching a client with pancreatitis about following a low-fat diet. The nurse develops a list of high-fat foods to avoid and includes which food on the item list? Option A. Chocolate milk. Option B. Broccoli. Option C. Apple. Option D. Salmon. Right answer is option A. Chocolate milk. Chocolate milk is a high-fat food. Fruits and vegetables are low in fat because they do not come from animal sources. Salmon is naturally lower in fat. The nurse is giving dietary instructions on a client who is on a vegan diet. The nurse provides dietary teaching focus on foods high in which vitamin that may be lacking in a vegan diet? Option A. Vitamin A. Option B. Vitamin D. Option C. Vitamin E. Option D. Vitamin C. Right answer is option B. Vitamin D. Deficiencies in vegetarian diets include vitamin B12, which are found in animal products, and vitamin D, if limited exposure to sunlight, are found in fruits and vegetables, which are eaten by a vegetarian. A nurse is caring for a client with Wernicko-Korsakoff syndrome. The physician asks the nurse to teach the client to consume thiamine-rich food. The nurse instructs the client to increase the intake of which food items? Option A. Chicken. Option B. Milk. Option C. Beef. Option D. Broccoli. Right answer is option C. Beef. Food sources of thiamine include beef, liver, nuts, oats, oranges, pork, eggs, seeds, legumes, peas and yeast. Poultry contains niacin. Milk contains vitamins A, D, and B2. Broccoli contains folic acid, vitamins C, E, and K. A client who is recovering from a surgery has been ordered a change from a clear liquid diet to a full liquid diet. The nurse would offer which full liquid item to the client? Option A. Popsicle. Option B. Carbonated beverages. Option C. Gelatin. Option D. Pudding. Right answer is option D. Pudding. Full liquid food items include items such as plain ice cream, sherbet, breakfast drinks, milk, pudding, and custard, soups that are strained, refined cooked cereals, and strained vegetable juices. Options are clear liquid diet. A postoperative client has been placed on a clear liquid diet. The nurse provides the client with which items that are allowed to be consumed on this diet? Option A. Vegetable juices. Option B. Custard. Option C. Sherbet. Option D. Bouillon. Right answer is option D. Bouillon. A clear liquid diet consists of foods that are relatively transparent to light and liquid at room and body temperature. Foods allowed on the clear liquid diet: bouillon, popsicles, plain gelatin, ice chips, sweetened tea or coffee, no creamer, carbonated beverages, and water, are full liquid diet. The nurse is teaching a client who has iron deficiency anemia about foods she should include in her diet. The nurse determines that the client understands the dietary instructions if she selects which of the following from her menu? Option A. Nuts and fish. Option B. Oranges and dark green leafy vegetables. Option C. Butter and margarine. Option D. Sugar and candy. Right answer is option B. Oranges and dark green leafy vegetables. Dark green leafy vegetables are rich in iron, while oranges are a good source of vitamin C, which enhances iron absorption. The nurse instructs a client with renal failure who is receiving hemodialysis about dietary modifications. The nurse determines that the client understands these dietary modifications if the client selects which items from the dietary menu. Option A. Mushroom and blueberry. Option B. Beans and banana. Option C. Fish and tomato juice. Option D. Potato and spinach. Right answer is option A. Mushroom and blueberry. A renal diet is one that is low in sodium, phosphorus, potassium and protein. Are high in sodium, phosphorus, and potassium. A client with heart failure has been told to maintain a low sodium diet. A nurse who is teaching this client about foods that are allowed includes which food item in a list provided to the client? Option A. Pretzels. Option B. Whole wheat bread. Option C. Tomato juice canned. Option D. Dried apricot. Right answer is option D. Dried apricot. Foods that are lower in sodium includes fruits and vegetables like dried apricot. The nurse is instructing a client with hyperkalemia on the importance of choosing foods low in potassium. The nurse should teach the client to limit which of the following foods? Option A. Grapes. Option B. Carrot. Option C. Green beans. Option D. Lettuce. Right answer is option B. Carrot. Carrots has 320 mg of potassium per 100 mg serving. Green beans give 209 mg of potassium, 194 mg for lettuce, and 191 mg for grapes, all in 100 mg serving. Other foods that are low in potassium include applesauce, blueberries, pineapple, and cabbage. A client is recovering from debridement of the right leg. A nurse encourages the client to eat which food item that is naturally high in vitamin C to promote wound healing? Option A. Milk. Option B. Chicken. Option C. Banana. Option D. Strawberries. Right answer is option D. Strawberries. Citrus fruits and juices are especially high in vitamin C. Meats such as chicken and dairy products such as milk are high in vitamin B. Banana is rich in potassium. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.